Coming up on Healthy Living, what health screenings do you need and how often? We'll have important information for women and men. And 3 painless screening tests can help catch a serious vascular condition before it's too late. Plus, it doesn't have to be a pain in the butt. Colon cancer screenings can save lives.
Your health questions answered. Welcome to Healthy Living, brought to you by the experts at Essentia Health.
Thanks for joining us for another edition of Healthy Living. I'm Michelle Lee. We all want to lead a healthy, fulfilling life. That often involves taking charge of our health and trying to prevent illness before it happens. But it can be confusing to know what screening tests we need and when. Let's start tonight's show by talking about some issues affecting women, like the need for regular mammograms. I'm joined now by Dr. Audrey Park-Skinner, who is a breast surgeon at Essentia Health. Thank you very much for joining us, Doctor.
It's a pleasure to be here.
First of all, why should women get those regular mammograms?
Mammography is still the best screening technique we have for early detection of breast cancer, and it's very important. It has been proven to save women's lives, and it's very important that women continue to get regular mammograms.
So when we talk about early detection, we talk about possible earlier cures.
Yes. Early detection of cancer not only makes cancers more curable, but also allows for treatments that are less radical.
Mm-hmm. When should women start receiving those mammograms? At what age?
At age 40, women should start talking to their physicians about getting into a regular screening program for breast cancer.
Mm-hmm. Have there been some mixed messages in this arena?
Well, yes and no. The need for regular screening mammography is never questioned. I think it's as I said, been shown very clearly that it saves lives and allows women to have less radical treatment. What has come into play is how frequently should we do mammograms, and there are a lot of controversial information out there that that perhaps less frequent screening is still all right. And for some women, you don't have to get yearly mammograms, but it's not for everybody. You need a mammogram at least every other 1 to 2 years. And it's best to discuss with your physician what screening schedule you should be on.
Mm-hmm. Getting back to that 40-year baseline screening, why is that so important? Is it so you can watch developments as they progress over the years?
That's right. Breast cancer, the incidence of breast cancer starts to go up at age 40. It really escalates after 50, but also there's breast cancer that occurs in women between the ages of 40 and 50 and that are detectable by mammograms. So that screening starting at 40 allows us to get a woman channeled into the appropriate screening schedule.
Mm-hmm. That makes sense. How can family history impact the need for these screenings?
Well, breast cancer is a cancer that can be passed on in families, and so it does increase your risk factor to increase your risk to have family members that have had breast cancer. So it's important to discuss this with your physician and to make sure that if you do have a family history, you are screened at a slightly different interval than women who have absolutely no risk factors. So
you touched on it briefly, but how often should a woman get a mammogram, say the typical 50-year-old?
Well, they should get it at least every 2 years, but there are a lot of 50-year-old women who need to get it more frequently, in other words, every year. And again, there's many different factors that go into that decision that should be addressed with the physicians.
Right, you should really form a partnership with your doctor.
That's exactly right. It needs to be a shared decision-making, taking into consideration several other pieces of breast cancer screening besides just a mammogram.
Okay, let's talk a little bit about self-breast exam. Is that still a good idea?
It is. The breast self-exam, the breast tissue is made up of a group of lumps. And so when we tell women to go out and find a lump, it's easy to find a lump.
It certainly is.
So the part of the problem with the original idea of the breast self-exam was that it was hard for women to know which lump was the significant lump. So the way that it has evolved now is that we tell women, get to know your lumps, get to know what your body is doing so that when something is changing or not your usual finding when you examine yourself, then that's something that needs to be called to the attention of your physician.
Mm-hmm. And you try to do it the same time every month?
Yes, it's a good idea to try and do it the same time every month, especially for women that are menstruating, because there are hormone changes in the breast.
Mm-hmm. Now, I understand that you have digital mammography at Essentia's breast program. How can this benefit your patients?
Digital mammography has the benefit of being able to see certain types of breast tissue more clearly, especially in younger women or women who have very hormonally active breasts. They have what's called dense breast tissue, mm-hmm. and it makes it a little harder to see things and detect things earlier. Digital mammography allows, like any digital picture, allows the radiologist to adjust the picture and be able to see more clearly certain findings in the breast. So certainly it is a method that allows radiologists to look at pictures more easily.
Mm-hmm. Just have a few seconds left, but for someone who has never had a mammogram, is it a pretty simple thing?
Yeah, well, a mammogram is a quick, especially a digital mammogram, is a very quick procedure. I'm not going to say it's always the easiest, mm-hmm. but I think, remember, it could save your life. I think it's really important, and it's just several seconds, really. It's not a long procedure. You can be in and out of there really fast, and it's a very important part of screening for cancer.
Well, thank you for coming in this evening and sharing this important information with us.
You're welcome. Pleasure to be here, Michelle.